This is Dr. William Freeman, Director of the UCSD Jacobs Retina Center. On our first floor, we are dedicated to the treatment of patients with new therapies. We also house advanced diagnostic instruments to help guide treatment and help diagnosis in patients with retinal diseases. We can measure retinal vision while we simultaneously view the retina. We are able to track blood flow in the living human eye and better understand and treat patients with diabetes and with retinal vascular disease. We have extremely high-resolution imaging instruments which allow us to detect disease nearly at the cellular level in the living human retina. We use these to guide and improve our therapies. We can also measure the ability of small areas of the living retina to see while we simultaneously visualize these areas in our patients. We are developing new instrumentation called the Vimetrics device to assess vision improvement and vision quality in our patients who are being treated.
The Vimetrics CVA utilizes a unique method to measure visual acuity. It presents image contrasts that mimic real-world environments of ordinary day and evening activities, providing improved patient observation, screening, as well as an adequate method of monitoring disease progression and treatment. Another advantage is that the testing utilizes presentation times that are required for real-life visual functions such as driving, reading, or facial recognition.
On the second floor of the center are the academic offices and research laboratories dedicated to basic scientific approaches to diseases of the retina. This floor includes conference areas allowing scientists to share ideas and plan new therapies and clinical trials and to confer with their colleagues. We have laboratories which are used to grow retinal stem cells and to develop new nanosensors which we are using to replace diseased retinal tissue. Also on the second floor, we have a large optical laboratory where new instruments are developed and tested. This is typically done with scanning laser ophthalmoscopes, which are ultimately developed for use in patients for diagnostics and for monitoring treatment. We have developed ways to image living human and stem cells that we can use to replace diseased retinal tissue and to understand these cells and to develop ways to program them so that they can function to ultimately replace diseased tissue in the human retina. We are also working on new ocular drug delivery methods with Dr. Ling-Wen Cheng, who collaborates with several large UCSD laboratories. In addition, with Dr. Radha Ayagari, we study the genetics of retinal diseases, including hereditary diseases, macular degeneration, and diabetes. Her laboratories are on the second floor of the Jacobs Retina Center, and we also collaborate with Dr. Kang Zhang and the genetics group at UCSD. Dr. Igor Kozak also works at the center. He is currently involved in developing clinical trials methodologies for patients with retinal disease, but also is studying diseased retinal tissue to better understand disease processes and to learn how to prevent these problems. We also collaborate with important colleagues at UCSD, including the Department of Bioengineering, Chemistry, as well as with the Salk Institute, where we are pursuing collaborative retinal research.